Assalamualaikum to Madam Mustaqiza and my fellow friends. Today we are going to present about tropical parasite. So here is our group member, Muhammad Lufiadi bin Muhammad Yusuf, meeting number 17, Nora Anna binti Osman, meeting number 67, Nuzatu Akuma binti Ayub, meeting number 20, Nushada Asnida binti Abdullah, meeting number 66, Rashida Banu binti Abdullah, meeting number 50, and me, Danisha bin Muhammad Nazri, meeting number 03. So the index on this topic is include evolution of tropical parasite and introduction, etiology of the parasite disease, clinical feature, clinical diagnosis, parasite characteristics, treatment and prevention, tropical infection in parasitology and epidemiology, and last one, conclusion.
Assalamualaikum, my name is Nizat Akmal binti Ayub. My matric number is MS20.
Evolution of tropical parasite introduction. Time period 150,000 BP pre-late. Homo sapiens emerged in Eastern Africa. 8,000 BC infection. American biological anthropologist Frank B. Livingstone proposed in 1958 that Plasmodium falciparum, the deadliest of 4 or 5 parasites that cause human malaria, hopped from chimps to human about this time as human hunter-gatherer begin settling on farms. 5,000 BC infection. Nematode eggs discovered recently in a frozen human body in Australian Alps date from this time. 3,000 BC to 4,000 BC. Medical development. The first written record of what are almost certainly parasitic infections come from this period of Egyptian medicine, particularly the Ebers papyrus of 1,500 BC discovered at Thebes. 2,277 BC. Infection. Ascaris lumbricoides eggs are found in human coprolites from Peru dating from this time. 2000 BC infection. Taenia and Schistosoma ova in Egyptian mummies date from this time. 1500 BC scientific development. The Ebers papyrus in Egypt give reference to roundworms, Ascaris lumbricoides, threadworms, Enterobius vermicularis, and tapeworm. What is tropical parasite? An organism that lives in tropical area that live on another species at its host and benefits by deriving nutrients at the other's expense. Scientists coined the term neglected tropical disease to cover everything from sleeping sickness to dengue fever to leprosy, but by far the most prevalent are 4 parasitic worms: roundworm, hookworm, whipworm, and Schistosoma bilharzia. Etiology of tropical parasite disease. Wuchereria bancrofti. Disease, lymphatic filariasis, caused by infection with parasite classified as nematode roundworm of the family Filariodidae. Onchocerca volvulus. Disease, onchocerciasis, also known as a river blindness, is a disease caused by infection with the parasitic worm Onchocerca volvulus. Schistosomes. Disease, schistosomiasis. Cause schistosomiasis. Live in certain types of freshwater snail. The infection form of the parasite, known as Cercaria, emerged from the snail into the water. Draconculus Medinensis. Disease, Draconculiasis, guinea worm disease. Is a parasitic infection by the guinea worm. Ascaris, hookworm, and whipworm. Disease, soil transmit helminth, STH. The intestinal worm infecting humans that are transmitted through contaminated soil.
Assalamualaikum and good morning to Madam Azhar and fellow classmates. I'm Nora Anna Uthman. I'm going to present about route of transmission. Okay, we start with Buccaria malayi. Buccaria malayi cause lymphatic filariasis in humans. In this diagram, we see how Buccaria malayi transmit the parasite into human body. Begin when mosquito bite us, and then they go to adults in lymphatics, and then next stage they go adult produce a shatter microfilariae that enter peripheral circulations where parasites start enter our circulatory system, and then from there mosquito take a blood meal. Which other area that they bite, mainly leg area. And then they go to microfilariae, shade penetrate mosquito midgut and migrate to thoracic muscle. From there they produce L1 larvae, and then from the L1 larvae, they migrate to mosquito head and proboscis, and then they also begin enter the skin. Next, finally, we're going to discuss about Draconculus Medinensis. Parasite begin when humans drink unfiltered water that contain copod with the larvae, and an infective copod ingested by fish, frog, or other aquatic animals. The larvae are released when copod die. Larvae penetrate the host stomach and intestinal wall. They mature and reproduce in subcutaneous tissue. And then the fertilizer female worms migrate to surface of skin, cause blister and discharge larvae. Undercooked fish harboring infective larvae eaten by dogs or people. Female worm begin to emerge from skin one year after the infection. The larvae released into water from emerging female worm, and then the larvae consumed by a copod. Larvae undergoes two molts in copepod and become a larvae.
My name is Noshu Haida Asnida. My metric number is 66. Clinical feature: Parasite Filariasis Bacterotic disease, Lymphatic Filariasis, Onchocercical Virus disease, Onchocerciasis, Schistosomus disease, Schistosomiasis, Draconculus Medinensis disease, Draconculiasis, Ascaris hookworm and whiteworm disease, soil transmitted helmintic STH, Bacterium Chlamydia trachomatis disease, trachoma. Clinical diagnosis: tropical parasite Filariasis Bacterotic disease, Lymphatic Filariasis. Clinical diagnosis: microscope, antigen detection, and antibody detection. Onchocercical Virus, Onchocercical Filariasis. The clinical diagnosis: the most common method of diagnosis is the skin snip. A 1 to 2 mg shaving or biopsy of the skin is done to identify larvae which the emerged from the skin snip and can be seen under a microscope. When the shaving of biopsy is put in the physiology different area, the physiology solution. Typically, 6 snip area taken from different area of the body. Polymerase chain reaction (PCR) of the skin snip can allow for diagnosis if the larvae are not visualized. In patients with nodules in the skin, the nodules can be surgically removed and examined for adult worm. Infection in the eyes can be diagnosed with a slit lamp examination of the anterior part of the eyes where the larva or the lesion that cause area visible. Antibody tests have been developed to test for the infection, though they are not widely available in the United States.
Assalamualaikum. My name is Rashida Banu binti Abdullah. My metric number is 50. Now I'm going with parasite character. They have few parasite and character. The first one is Ucharia bankrupti. It's a filarian nematode that has an adult in a drifter like 1, 1, 2, 3. The female nematodes are 10 cm long and 0.2 mm width, while the males are only about 4 cm long, 1, 3. The second is Onchoria volvulus, known as a river blindness, is caused by the parasite worm Onchoria volvulus. The third one is Schistosmus, are not hermaphroditic but diseases forming separate sexes. Adult worms have elongated tubular bodies, each male having a unicorn gynocerebral canal, Schistosomus body in which a female worm resides. The fourth one is a Draconculus Medinensis, is one of the large nematodes. The female is usually 60 cm in length and has been reported up to 3 m. The male, which are much smaller, are usually 1.2 to 2 cm long. Both male and female worms have small triangular mouths surrounded by a conductor plate but not lips. The fifth one is Acaris, hookworm, and whiteworm. It's an intestinal parasite of human. It is the most common human worm infection. The larva and adult worm will live in the small intestine and can cause intestinal disease. The sixth one, Bacterium Xylomia tractum, member of the phylum Chlamydia, are oval in shape and are gram-negative. Now, I'm going with treatment and prevention. So, the first treatment is for Ucharia bankrupti. The disease can get is lymphatic filariasis. The main goal of treatment of an infected patient is to kill the adult worm. So, the second is Unsurvivable Virus. The disease is Unsurvivable is infection which will need to be given every 6 months for the lifespan of an adult worm, or for as long as the infected person has evidence of skin or eye infection. The third one is Schistosmus. Schistosmus can usually be treated successfully with a short course of medication called parasite tunnel that kills the worm. And the fourth one is about Draconculus Medinensis. It's called the disease guinea worm disease. Guinea worm disease can be prevented by avoiding drinking unsafe water. The fifth one is Acaria hookworm and whiteworm. The disease is soil transmitted helminth. Prevention and control measures to prevent soil transmitted helminth are the following: availability of clean water for personal and domestic uses, improves access to sanitary, which include the use of property function and clean toilet by all community. And the last one is Bacterium Chlamydia. It's a trachoma. In the early stage of trachoma, treatment with antibiotic alone may be enough to eliminate the infection. Your doctor may prescribe TI ointment or oral azithromycin. It's called Citramus. That's all. Thank you.
Assalamualaikum, good evening, Madam Mustakizah. My name is Muhammad Lufi Hadi by myself. I'm from Group Jabal Al-Hayyan. My metric number is MS17. I'm going to talk about the tropical infection in parasitology and their epidemiology. The type of parasite number 1 is Wuchereria bankrupti. Its epidemiology is endemic in 78 countries and affects 128 million people worldwide. This nematode is widespread throughout humid and tropical zones of Asia, Africa, the Americas, and the Pacific Islands, and is common in areas with poor socio-economic levels 1 to 7. Number 2, Onchocerca volvulus. Its epidemiology is most widely known for causing river blindness. Onchocerca volvulus infection affects an estimated 17.7 million people worldwide in 34 countries in Africa, the Middle East, South America, and Central America. Number 3. Schistosomes. Its epidemiology is prevalent in tropical and subtropical areas, especially in poor communities without access to safe drinking water and adequate sanitation. It is estimated that at least 90% of those requiring treatment for schistosomiasis live in Africa. Number 4. Draconculus Medinensis. Its epidemiology is globally. 3 countries reported a total of 1,435 dogs and 6 baboons infected with Draconculus Medinensis in 2088. Of the more than 2,426 rumors reported and investigated during the reporting period, 98% were investigated within 24 hours. Number 5. Ascaris, hookworm, and whipworm. Its epidemiology is living in the Ranomafana rainforest of southeast Madagascar global. And lastly, bacterium Chlamydia trachomatis. Its epidemiology is it is estimated that 1 in 20 sexually active young women aged 40 to 24 years has chlamydia. Substantial racial or ethnic disparities in chlamydial infection exists, with prevalence among non-Hispanic blacks 5.6 times the prevalence among non-Hispanic whites. Chlamydia is also common among men who have sex with men, MSM. The conclusion is we have more than 300 species of parasite from around globe. Each parasite will carry different types of disease and have their own habitat and epidemiology. And thank you.